was this heart attack in his heart. If he had a heart attack and then immediately died from it within minutes, the kind of classic scenario, man mowing the grass, clutches his chest, falls to his knees, and he's, dead before the ambulance gets there. When I look at that guy's heart, I'm not going to see any evidence of a heart attack because he didn't live long enough for his body to start the process of healing. And without that process of healing, I don't see anything, either microscopically or with my naked eyes, that he's had a heart attack. Now, if he had a heart attack 2 years ago or a month ago or 2 days ago or, 12 hours before he finally died, then I can see variable changes that kind of tell me if it was years ago, months ago, a week ago. I think that, Christopher probably had, first there's sort of two different processes that were going on in his heart and his aorta. In the aorta, after it leaves the heart, it heads up towards the head for just a second before it curls and heads back down along the spine. So that area where it first started turns and starts to head back down along the spine is where he had a small little disruption in the wall of the aorta, and some blood had leaked out into the connective tissue on the outer, that coats the outer surface of the aorta.
Right.
But so that was a small little pocket of blood. It hadn't
old
ruptured.
Or new?
It was dark. It was in between. It wasn't like in the last few minutes or hours, but it also wasn't like a month old.
Okay.
So it was probably just a couple of days old at most.
Okay.
Maybe even just a day old. But it hadn't ruptured. But wasn't that? His was walled off by the connective tissue there around his aorta.
Okay.
Now, so that had been there for some time, but that wasn't the immediate reason why, he died. Obviously, we know why he died, but at the time I did the autopsy, I knew that wasn't, I wasn't under the impression that had killed him. What I originally had thought had killed him before the cyanide came back was the malformation of the coronary artery. But in Christopher's case, in anybody, in the normal, the usual anatomy coming out of the aorta as it leaves the heart, to the very bottom part of the aorta where it first leaves the heart is where you have the origin of the coronary arteries, and there's two of them. One goes and covers the left side of the heart, and the other covers the right side of the heart. And they kind of come off of opposite sides of the trunk of the aorta, the base of the aorta. And in Christopher's case, the one that goes to the left side was fine and perfectly normal. The one that goes to the right side, instead of being one, nice large caliber artery, it was actually three very small openings called ostia.
Right.
And so they were sort of in a triangle configuration. And so the superiormost one was the biggest one. It was still smaller than the usual, but that was the bigger of the three, and it leads to the normal distribution of a right coronary artery almost. And then the other two that formed the base of the triangle, so to speak, were small. They were slit-like, and they came off at funny angles that didn't allow very much blood to flow through. They go alongside the larger of those three, the top one, and then they kind of branch off and go off to different parts of the heart muscle.
Right.
Well, in the area that would ordinarily be supplied by those little branches that were going off the back wall of the heart, that's where there was an area of what appeared to be nice new, what we call like fresh or recent myocardial infarction. There was heart muscle that had been damaged by a lack of blood. In a general sense, the appearance of that puts it at the kind of age of more than a few hours, but less than like a day and a half. So,
Right.
so
See, that kind of screams to me, I mean, tell me if I'm wrong, but that kind of screams to me again, long-term poisoning, other than just that one deadly, lethal time.
Well, maybe not. If he had perfectly normal appearing coronary arteries and we saw that, then maybe. But he's got small caliber coronary arteries. When you have small coronary arteries that aren't distributed in the right manner, then blood flow is not going to move through those very sort of a ticking time bomb in that situation, where any stress to the heart, such as running up a flight of stairs or getting excited over watching an action movie on TV or consuming cyanide, causes a need for more oxygen to the heart muscle.
Oh,
And
wow.
when you've got small blood vessels that can't supply the blood with the oxygen, to that heart muscle, then you have a heart attack. They very well may have been due to long-term cyanide poisoning, but there's just so many other things that could account for that too. I think that ultimately what it comes down to, and from my standpoint, as far as the manner of death, I still have it classified as an undetermined manner of death. I just don't know what the intentions were, how he ended up consuming the cyanide. None of that. I'm looking at him at 8:30 in the morning the day after he was found. He was found at 4 p.m. the afternoon before.
Right.
So I'm confident he was dead more than 6 hours, but probably less than 24 hours. And that's about as accurate as I can really get as far as that's concerned. Remember, all of these things are sort of on a bell curve,
Right.
where we say that the majority of the cases are right in the middle of that bell curve where the peak gets highest. But on each end, the low end and the high end, there are some situations that fall there, although very, very few.
Right.
So we just kind of take the average and say that Erick probably had lived, 6-8 hours after his heart attack before he died.
Maybe an hour after the heart attack?
No, I mean, it could have been, it's probably more along the lines of several hours.
Okay.
6, 8, 12 hours.
We needed the tissue in the hair samples so bad.
Yeah, I do regret, that we didn't have that kind of insight to be able to collect that ahead of time. That, of course, would have been, crucial in this situation to be able to determine that.